Hi, my name's Julia Zimmerman and I'm one of the young Gesteiners, and today I'm interviewing
John Cylus. I'm the head of the London hubs of the European Observatory on Health Systems and Policies.
So John was a speaker on the panel discussing the importance of long-term care and investing in long-term care. So my first question, John, is many people still see long-term care as a cost. Why do you believe it is actually an investment for a country's future?
Thanks, Julia. So I think it's important to look at this from the counterfactual perspective. So what happens if you don't invest in long-term care? And if you look at countries where there is no significant formal long-term care system, you have lots of predominantly women, adult women who are out of the labor force because they're caring for people, older relatives or relatives with care needs. You have people who are becoming impoverished because at the onset of delivering care, because they have to leave work or because they have to pay for some formal care out of pocket. So I think if we think about what are the consequences of not having a formal long-term care system, we see that it's really bad for the economy, we see that it's really bad for households.
Great. And with many countries looking at improving their long-term care systems, what are some of the challenges that they commonly face?
So I think there's a number of challenges. Obviously, even though populations are aging everywhere, most people at older ages will have some care needs. I think that there's still a lot of thinking about long-term care as being an issue for a very small segment of the population. It's very hard to imagine oneself as being in need of care. So I think it doesn't necessarily become so high in policy priorities. That said, following COVID, there have been in many European countries increases in public expenditure on long-term care, following all of the challenges that countries faced caring for older people, especially in residential care facilities. But I think there's other issues that also make it difficult sometimes to improve access to long-term care. So for example, I'm working a lot in Ireland these days. And in Ireland, residential care is statutory. So everyone, if they have a need for residential care, they are legally eligible for it. Home care, which is obviously the priority, to keep people at home for as long as possible, is not statutory. People don't have a right to it. And you might say, okay, well, that makes no sense. If the priority from a policy perspective is to keep people at home, why wouldn't you make this statutory? But making something like home care statutory has lots of challenges. First off, what is home care? How do you define what it might be that someone has a statutory right to? You have workforce issues. How do you make sure that someone has the right to home care if you don't have enough home care workers? So there's a lot of prerequisites to figuring out how to actually strengthen long-term care. It's not just about finding the money. It's also about knowing what it is that you're providing and being able to have the non-monetary resources as well.
So given all the challenges in improving long-term care and the threats of not doing it, what is your one main message that you would like to convey to policymakers and citizens?
So I think that there's lots of these messages about demonstrating how investing in long-term care benefits everyone, how it benefits other sectors. I think the most salient one is probably talking about how investing in long-term care benefits the health system. So especially after COVID, many countries are facing challenges obtaining enough public revenues for the health system. So health systems are under a lot of strain. And if we think about at the same time that budgets for health are either growing more slowly or being cut, we think also about the aging population and these increasing needs for long-term care. If we look at countries that have not invested in long-term care, where do people end up when they have care needs? They end up in hospitals. They end up taking away acute care resources that could otherwise be used for people who have needs that could be dealt with more appropriately in a hospital. So I think a key message that I would give to a policymaker is that by investing in long-term care, you're not only improving access to long-term care, but you're freeing up other resources in the health system, and you're able to tackle other policy priorities like waiting lists and improving quality of care.
Fabulous. Thank you so much for your time, John.
Thanks, Julia.